Hi Betty, how are you?
Okay, how are you?
Oh, I'm good, thanks. My name is Melissa Osborne. I'm a drug and alcohol case manager. I'm here to assist you with any resources that you may be in need of. Would you like some water or coffee before we begin?
I'll have some water, please.
Yeah. Here you are.
Thank you.
You're welcome. Okay, I'm going to be getting some info from you, so I'll be taking some notes. If there's anything at all that you don't understand, let me know and I can help you.
Okay.
Okay, so what brings you into my office today?
Drug problem.
Okay, well, have you in the past or are you currently involved in any other treatment facilities or social service agencies?
I have been in the past.
Okay, which ones?
I've been in Cove Forge and Greenbrier.
Were you able to stay clean for any amount of time after leaving the rehab?
No.
Okay, did you follow up with your aftercare?
They didn't give me aftercare.
How about 12-step meetings? Have you ever attended any?
Which 12 steps?
Well, that's a meeting, a support group for people who are addicted to drugs.
No.
Okay. Well, what kind of drugs are you using?
Heroin.
How much and how often?
Between 5 to 6 bags a day.
Okay, how long have you been using?
Over 12 years.
Okay, how do you think your drug use has affected your relationship with your friends and family?
Well, my family's bad. They, it's just terrible. They don't want to be around me because of it. My children, I have 3 daughters, and they don't want to be around me because of it. I have 5 grandchildren who I don't see that often because of it.
Okay.
Friends, I don't really worry about because I'm more family oriented. I would care more about my family than I would my friends. So.
Do you have any friends that aren't using?
That aren't using? Some, yeah. I have a few that don't. But I don't hang around them.
Okay. But you were pretty close with your family?
Yeah.
Before the drugs? Okay, well how does this all make you feel?
Like crap. I don't feel right about it. I know it's wrong, but it's not I can do about it. It's under control. It has me,
Yeah, kind of
uncontrollably.
in a bad spot. How has it affected you financially? Are you able to hold a job?
No, I've had jobs that I couldn't keep because of it. I didn't have to get up in the morning to go, or when I'd pay me, I'd leave work, wouldn't come the next day.
Okay. So it's definitely affected you financially. So you think your life has become unmanageable due to your drug use?
Most certainly.
Well, would you be willing to enter a detox? Inpatient?
No. I can't do inpatient because I take care of my mother, and it's impossible to do an inpatient.
Okay, so you would prefer an outpatient program?
Yes.
Okay. Do you have support at home?
Yeah. If I was to quit, I would have the support. It's just I got to make that step to do it. Yeah.
Okay. So you're looking for like an outpatient program so you can take care of your mother, and it can help you with detox, and
Yes.
you'll be willing to do the groups?
What kind of groups?
Well, they will have like mandatory groups. I don't know if it's 3 days a week. I'm not really sure.
Therapy groups?
Yes, it's therapy.
How long? How many times?
Well, we're not quite sure exactly what you're going to be entering into, if it's going to be an intensive or a partial.
Okay.
Okay, we'll determine that on the next visit.
Okay.
Okay, well, let me repeat back to you what I perceive you to be saying, because I want to be correct in what I'm hearing. So, you've been to 2 other treatment inpatient facilities. Your drug of choice is heroin, and you're using it every day, shooting it. It's affected your relationship with your family, and you don't really have any friends that you talk to at this point. You have no money, can't keep a job. Definitely your life has become manageable, but you do have support at home, and you've never attended 12-step meetings. And you'd also prefer an outpatient.
Mm-hmm. Yes.
Okay. Can you make it back to my office next Wednesday at 9:30?
Sure.
Okay. Well, at our next appointment, there's a few things we need to do in order to have you entered into our outpatient rehab. We're going to do a full assessment, and if you have an ID?
Yes.
State ID? Okay, and how about insurance?
Yes, I have that.
Okay, if you could bring that, your insurance cards, that would be great. Then we can identify some goals you would like to work on. Do you think you can stay clean until our next appointment?
No.
Okay, well, in the meantime, if you feel like you do need help, call me or call this number. This is a 24-hour crisis hotline. And thank you for coming in. You've made the right decision to seek the help that you need. And if you need to reschedule, please call me. Oh, wait, I gotta do this. Okay. So in the interview, I incorporated active listening skills, empathetic responses, made the client feel comfortable. I also affirmed help seeking and gave her information on what our next appointment is and what we would be doing, what to bring. And the skills I plan to work on for my next interview is to explore the client's help her recognize her strengths, set goals, collect information, develop a service plan, and sign the proper consents.